Hey friends, my dear buddy Erin Porter is here. She's been on this show before. Welcome and thank you for coming in.
Thanks for having me.
And the reason I have this bilateral monocle on my face is because I was reading this, A Journey from Chronic Illness, Brokenness, and Junk Food Junkie to Wholeness and Wellness. I forwarded this book, so I had to read it. So I lend my name to a lot of books, a lot of people write, and I generally look at chapter 1, advance to chapter 7, and then see the crescendo at the end of the book, and then I write. I literally couldn't put this down. I had no idea about the abuse that you've been through. I mean, this was an amazing, transparent book that was written. How did the name Eat, Pray, and Get Well, where did that name come from?
Well, I was trying to think of a title, and I thought, how did I get well? I had to change the way I eat, and boy, did God guide me through prayer, even down to what doctor to go see. And Eat, Pray, Get Well.
And you
That's
got
how
well.
I got well.
And you
Yeah.
got well. And you've had a few sinus surgeries. This last one, you had a little melanoma that they noticed. And I want to...
It was basal cell, thank God. It
Okay,
wasn't-
good.
Yeah.
Basal cell carcinoma, that's called. If you're squeamish, don't look at this picture. It's post-surgical. She came out of surgery. On the left, that is her all bandaged up for a few days. That's under the bandage on the right. It's hard to look at that and then look at you and that guy was genius, whoever did your surgery.
He did a great job.
Yeah.
And he's so young. I think he's about 30 years old.
Yeah,
but,
exactly.
They told me to pair up with a plastic surgeon just in case. And I think I was in denial. It was the size of a freckle.
Yeah.
And they told me, don't go to a plastic surgeon that does, eyes and other parts of the body. This guy is very good. So I thought, well, it's not going to be anything anyway. It'll probably just be a little slice.
Right.
And was planning where I'd go out to dinner that night because I'll have a little Band-Aid on. But that's not exactly what happened.
And you know what? Listen, I need to say this. Thank God you got that done. These are called Mohs procedures. M-O-U-S, Mohs, right? Procedures. And what they do is they begin cutting and they open more and more and more, and then they do laboratory tests to see if there's any more of the melanoma in the tissue, half an inch from it and so forth. M-O-H-S, I'm sorry, is how you spell that. And I scrubbed for these for some time many, many years ago. I'm not going to date myself, but it goes back a long way. And it looked a little bit gross, but these, the skin heals.
It does. It was scary in the beginning because they did have to do flaps from the forehead and 2 flaps from the side. And when that bandage came off, I cried.
I'll bet.
I did not look like myself.
But here you had chronic sinusitis all of your life.
Right.
And on top of that little sinusitis grew, dare I say, a mushroom, a cancer. So many of these dermatophytes make melanin and get their energy from the sun or from UV lamps. So it just makes total sense. But you're okay. And how is the sinus problem?
The sinus problem is better, thank God. And I thought about that. So many years of fungal infection in my sinuses, I always wondered, is that what caused? Because in my heart, I don't feel like it was the sun.
Yeah.
It's probably more likely the fungal infection, the toxic makeup and sunscreen that I've done all my life.
Wow.
So that completely changed too.
I told you about a 1957 book on mycology. A doctor friend of mine who went to Johns Hopkins had it. And it said basal cell, was it basal? I think basal cell carcinoma frequently is mistaken, or a fungal infection frequently is mistaken for basal cell carcinoma. And it got me thinking, it's strange the way we're seeing more and more and more cancer today. And oh, by the by, we've all been on antibiotic after antibiotic after antibiotic. And a lot of us have fungal infections.
Yeah, and although he did a wonderful job, and I feel grateful it came out, I just regret every day because I see the scars. I have a lot of makeup on my nose right now, but I wish I had tried a couple months of antifungals. With everything I know, I got scared into jumping into surgery and cutting it out.
Look,
where I wish I would have just...
I don't blame you. Given the circumstances, I might have done the same thing, especially when you think, okay, I'm going to wake up with a spot Band-Aid on my nose instead of being open up like that. The book, you'll cry in the opening. You'll get all the way to laughing by the time you've read through it. Eat, Pray, and Get Well. It's authored by Erin Porter, and I'm telling you, she has done a stellar job of putting this book and this whole philosophy, this antifungal approach to your health problems together. Thank you for who you are and what you've done.
Thanks, Doug.
You know, many years ago, Dr. Richard Ablin, a guy I really respect, he's the guy in 1970, I was in Vietnam, he was a professor, a scientist, and he discovered the PSA molecule. The PSA. I have said long before I knew him, the PSA test doesn't work. I think science is finally grasping that also. And boy, they've oversold it to the detriment, in my humble opinion, of huge numbers of men. I don't think I've had a PSA test, but I got an insurance physical years ago and they drew blood. And so I bet they did a PSA, so I must have been normal. Normal is 0 to 4. In an older man, maybe 0 to 5, somewhere in there. But boy, don't tell urologists that, because if it's 4.1, they're going to dig and do biopsies and so forth. Don't get me started. What if swollen PSA had more to do with fungus than anything else, okay? Let's start by showing you a little study that came out 21, 22 years ago. Antifungal drug treats prostate cancer. Well, I'm thinking 22 years ago, of course it does, because prostate cancer is a fungus, okay? Look at this. The antifungal drug was used in combination with cortisone. It was called ketoconazole or Nizoral. It was published in the Medical Tribune 21, 22 years ago. Why would an antifungal drug help prostate cancer unless the PSA test that diagnosed the prostate cancer was a fungus test? Wouldn't it be wild, guys, if the PSA test was actually some kind of a fungus test? And the doctor didn't know that. They still don't. By the way, this is published in a book. I put it somewhere back here, but at any rate, it's written by, here it is, right here. I think this is it. It's written by a doctor named A.V. Costantini. Dr. A.V. Costantini was a friend of mine, and he wrote a book called Prostate Cancer, Hope at Last. Here he is in the middle, two other doctors. They're with the World Health Organization. They were bona fide physicians, and in that book, he approaches that question. What is the PSA test? Prostate Cancer, Hope at Last. Look at what he said, and I quoted him. Structurally, the PSA molecule that Dr. Ablin invented is a 33 kilodalton serine protease. It's an enzyme which is found to be made by 5 sac-forming fungus. Wait a minute. Didn't the doctor put a glove on and put his finger in my rectum and he felt a nodule on my prostate? It was a sac, wasn't it, on my prostate? Gosh, Doug, that couldn't have been a sac fungus. And yet 5 sac fungus, or 5 sac fungi, make this PSA test. Form the enzymes that make up the PSA test. Folks, if you're confused, so was I. Could this be the biggest nightmare men have ever experienced? By the way, Dr. Ablin taught me, open your hand, push on that muscle with your finger. That's what a normal prostate feels like. Close your hand, push on that knuckle. That's what a nodule on my prostate might feel like, okay? So, this is fascinating to note, folks. I think we are hyper-diagnosing. You've learned on my show, Know the Cause, that the British Medical Journal found that the mammogram is about 58%. You factor in false positive, false negative. It's about a coin flip of accuracy. Same with the flu shot. Now we're learning that the PSA probably never was prostate specific. So even the name doesn't apply because pregnant women can have elevated PSAs. They don't have a prostate. Be careful out there. Just know that it's a good idea to visit a doctor, and that's one opinion. Then delve in. Go to Know the Cause. Study my work. Many doctors are now preaching this. Cancer and fungus? It couldn't be, could it? Could this be a huge mistake? I don't know. But that's what my research leads me to. I just need to land it here. If you have prostate problems, atherosclerosis, think back. Did you have a history of antibiotics? And never take my advice. Always take your doctor's advice. I'm just a seed planter. God bless you.